Megan Stewart is the founder and executive director of PCOS Awareness Association, one of the leading organizations dedicated to education, advocacy, and support for people with PCOS. I sat down with Megan and we talked about what PCOS really looks like, how it can, fit with classical symptoms, how it can veer away from that, and really where the gap is in diagnosis and care for those with PCOS. It was really such an eye-opening conversation to hear about Megan's personal story with PCOS and also just how she's flipping the narrative and really advocating for women, supporting them, advocating for themselves in getting the care that they really need with PCOS, which is incredible. I hope you enjoy this episode. And if you're inspired to, take a look at their organization afterwards, I definitely encourage you to do that. Their website is pcosaa.org. And they've got so many resources there, so many programs for people to be able to educate themselves about maybe their own PCOS diagnosis, but also how to support others around you. So there's so much, beautiful information there that you can take. So I highly encourage you to do that. Megan Stewart, thank you so much for being with me today.
Yeah, thank you. I'm excited.
Yeah. So first, I'd love to hear more about you and have our listener learn about kind of just your story and how you got into what you do.
Oh my goodness. How much time do you have?
Give us the abridged
No, no,
version.
no. Right. So, actually, I started showing symptoms of polycystic ovarian syndrome around the age of 9.
Mm,
And those symptoms that I had were, missing, lack of menstrual cycle, weight gain. I was super moody. My mom can, till this day, she still complains about how moody I was. I'm like, give it a rest. It's been 30 plus years. Come on now.
mhm.
And then as along with I was getting like a lot of hair growth on the face and hair loss on my head. So I was a very active child. I was an equestrian, basketball, volleyball, just very active. There was never a moment where I was just like still. So with the weight gain, my mom was really like, "What is happening here?" And then also no cycle. Um, my mom started her cycle when she was like 11, 10, 11, someplace. And so she was expecting me to be like 10, 11, someplace around there. But it just never came. So she was like my largest advocate. Shout out to Doreen because she was my largest advocate and she just like took me around from medical professional to medical professional, trying to get to the bottom of the answers that she was looking for and just nobody was giving her the right answers or the answers that she felt was correct. So some of the answers that she was getting was that it was normal. I was just, adolescent going through puberty, and this is something that I had to go through. Or she was getting, she just needs to lose weight and she'll be fine. Or the ultimate one that really set her off was that it was in my head and that I was faking things to get out of school and get out of activities and stuff like that. Um, my mom did a couple of things to kind of like, you know, figure out if these things were true. She, at the time, she joined Weight Watchers and had me join Weight Watchers. And this was back in the day when Weight Watchers, you went into like a meeting every weekend, they weighed you, and then you sat in this meeting, and then they would be like, Yay, so and so lost such an amount of weight. Let's all give a kudos and a gold star type thing. Well, again, I was young. I did not control like my foods, my breakfast, my lunch, my dinner. My mom did. And then I also didn't control my schedule. Like she very much controlled my schedule. Like you're going to do this, be here at this time, right? So, with her making my meals and her running my schedule of like my activities and whatnot, you go into that meeting and you already feel I don't know. I personally felt like I was being attacked. I remember
Mhm.
that very vividly. I feel like I was being attacked. And then when it came down to the weighing part and announcing everybody's weight loss journey, I just remember one week my mom had lost in the week, she had lost like 2 pounds. And then it was like, and then Megan lost 0.05 pound. Like, wait, what? So it was just kind of like, oh, okay, something's really wrong here. And then I recently found out, like within the last like 6 years, I found out that my mom, to find out if I was faking things, she actually gave me a placebo pill.
Mm.
I was like, you did what? She said, yeah, I gave you a placebo pill. I had to know. Like I had to figure out if this was like if you were faking things, but lo and
Mhm.
behold, no. She said that she gave me the pill, and like the first week or so, I was like cured.
Mm.
But then the weeks after, everything came back in tenfold. So it
Mm.
was then that she knew that something was really wrong. I also had pelvic pain, so
Mm.
there was just a lot of pelvic pain happening, and she was just like, "Yeah, there's something wrong." Finally, at the age of 16, so from eight, or I'm sorry, 9 to 16, I was just struggling. Finally, at the age of 16, I was formally diagnosed with PCOS. And along with that, I was diagnosed with cervical cancer. So
Mm.
it was like, we're not gonna, I just remember the doctor saying, the OBGYN saying, don't worry about the PCOS. Come back to me when it's time to have children. And I remember to
Mm.
myself thinking, ew, no, no, I'm not, no, that's not my life.
Mhm.
So, of course, the cervical cancer was at the forefront of things. But after getting that under wraps and whatnot, um, I was about 21, 22 when my PCOS symptoms showed their ugly heads again. I didn't have health insurance and I was working at a job. And I just remember walking in that morning and sitting at my desk and them, everybody around me saying, "Are you okay?" And I was just like, No, I don't really feel well." And they said, I just looked clammy. I looked clammy. I looked, my color was not there, just pale, like something was wrong. I called my mom. My mom met me at the ER. And they said to me, "Oh, so we see in your chart that you have PCOS. We're going to go ahead and do an ultrasound. And after the ultrasound, your cysts are rupturing,
Mm.
and there's just nothing that we can do for that. Like, this is your life." And I'm like, no, 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 no. My mom, to this day, she'll tell you that walking out of the ER, she saw that I had a fire lit in me and that there was something that I felt strongly about making a change, whether it was internally with myself and or trying to find like resources and answers and all of that. So out of that, I'm very close with the rest of my family. Like, we're a large family. My dad has 9 siblings, mom has 4 siblings, right? We're just a large family. So I just remember all my family members contacting me, making sure I was okay, coming out of the ER and checking on me. And I told them, I was like, this has to do with PCOS. And they were all like, well, what's that? I had done some research and found out that the official color of PCOS was teal. So I said to my family, okay, well, here I'm telling you about PCOS, but now I need you to wear these handmade teal bracelets that I made. And if anybody asks you, you now tell them about PCOS.
Mhm.
And this was around the time that Instagram had like started, right? I had a cousin that this was also around the time that Wonder Woman had come out, the movie's Wonder Woman.
Mhm.
And she's got that infamous pose where she's like this. One of my cousins had ordered from me like arm full of the teal bracelets that I was making, and she went on Instagram and did this pose with her arms full of the bracelets and tagged me and hashtagged PCOS. um I kid you not, within like a week, I had people from all over the world contacting me, asking me or saying to me, I have PCOS. I've never seen anything like this. How can I get a bracelet? I want a bracelet. I need more information about PCOS. And that's really what like sparked, the light bulb went off in my head, and it was like, okay, I'm not the only one. I keep like there's so many people out here struggling. Like, how do I help? So that's when PCOS Awareness Association was born.
Amazing. Well, I mean, what a journey you had.
Right.
But also, I can't imagine a better person than to be able to lead this type of movement to educate people because you did have such a, difficult journey with it. And maybe it sounds to me like an extreme experience of it too.
It
And,
was,
you
yeah,
definitely had like very extreme symptoms and so early on and had to struggle with it for so long, which again, it's very unfortunate. Of course, I wish that never
definitely.
happened to you, but how amazing to be able to change that story and take it and then be able to educate women and especially just like make those women who have it feel seen and
Absolutely.
understood and be able to educate the people around them and everything. That's so incredible.
Yeah, thank you.
And I think your story really too highlighted, we can kind of skip ahead as far as
Yeah.
what is PCOS. I think more people are aware nowadays, but I think you also laid out like what it can really look like. Again, maybe
Mhm.
some typical symptoms, maybe some not so typical symptoms, and how difficult the journey can be. Maybe like how prevalent is PCOS? Maybe start there.
Yeah. Yeah, absolutely. So, back when I first started things, the statistic was 1 in 10. In the recent years, I have seen studies saying it's 1 in 5.
Hmm.
So, it's funny that I walk around and being so heavy in the PCOS community, I walk around and I literally look around and I'm like, 1, 2, 3, 4, 5, me. And then I count again, 1, 2, 3, 4, 5, one of y'all. Right? Like
Hmm.
I literally can in my head, I do that. And it's funny because my boyfriend's now recognizing, signs and symptoms in people that he knows. And he's like, do I tell them? And I was like, well, you don't straight out say you have PCOS. Like, please don't do that. But at least be like, hey, have you ever heard about it? Like, have you ever heard about it or asked anybody or known anybody with it? And most of the times when you do ask that question, people mostly say, I've never heard of it.
Hmm.
Never heard of it.
Hmm.
And that's part of the problem is that the education about around PCOS, not just in the medical, like that's a whole nother that's a whole nother thing, but just in general, that's one of the things that like PCOS Awareness Association is trying to do is bring that education earlier, right? Can you imagine what it would look like? I mean, we all go through sex ed, right? We all have that class where they separate the boys from the girls, and the
Hmm.
girls get to learn about their cycles and everything. What if they stated something about PCOS during that session? It's a week-long session that you're like, you can talk about these things and not feel uncomfortable you still feel uncomfortable, but I remember you still
Yeah,
feel
that's true.
uncomfortable,
Hmm.
but you can talk about it with other people that may have the answers and or maybe going through similar situations with you. And just again, the medical side of things, if the education was there, I think that because it's a syndrome and not a disorder or a disease, and it looks different in everybody, that it just makes the education portion in the medical field very difficult.
Yeah, absolutely. And you're so right, even though, there's criteria for diagnosis and things like that, it can so easily be missed. If someone isn't going
Absolutely.
in saying, I think I have PCOS, the doctor might not think of it also, especially if it's like, hair loss and stomach pain,
Right.
things that are like, well, they're not exactly hitting right on the dot.
Right.
So they're maybe
Right.
not doing the testing to actually meet the criteria to then get the diagnosis. And that is a whole other thing too, in my opinion. It's one of my pet peeves of just the diagnosis of PCOS is a bit ridiculous because so many women
Yep.
now we know that there are these different types of PCOS that may not even fit the
Yeah.
criteria. And so especially in my world, I have people who are coming to me that have hormonal concerns. They know something is off. They're trying to figure it out. And so then we can like look at that and really say, okay, well, maybe you meet some criteria of PCOS, but not all of them, but it really fits the mold. It seems like it, so let's treat it. Um, but yeah, it can be such a barrier for sure. And with that,
Absolutely.
are there any statistics as far as, that diagnosis, the lag time? I don't know if there is data on
Mhm.
all that. Yeah.
There is. Yeah, it's last I heard it was like it take up to 7 years for
Oh.
a woman to
Mhm.
start to finish. And we're talking like 70% of the women that are going in to talk to their medical professionals about something that could, like you said, could fit the mold of
Mhm.
PCOS, and they're being passed off. There's so many things that also could look like PCOS. We have a lot of women that Hashimoto's, I'm sorry, what am I trying to say? For the fibroids,
And yeah, or endometriosis.
endometriosis,
Hmm.
right? Like all these things, they have similar symptoms. A fatty liver disease,
Hmm.
have similar symptoms that, it just um, it takes a medical professional that is really willing to work with you. And I hate to put it this way, that cares about you. I really hate to put it this way.
Hmm.
But in the same sense, sometimes it's really difficult I mean, they see like what? I don't even remember what the like minimum a day that they should be seeing, like an OBGYN connected to a hospital um has to see a minimum of a certain amount of patients a day, like that. Ooh.
Yeah. Yeah. A
It's
lot of
tough.
doctors will see like 25 to 30 patients a day, and they're like, yeah, jammed into these things. And I can say it confidently from my own experience of being in that world for a long time and then being able to get out of it is that, the doctors care, but they're also
Yes,
limited with that time and they're overwhelmed and they can't keep the patients straight because they're seeing them back to back. And so, yeah, the system is not made for people to be, really looked at more deeply. It's really, what's your problem? Here's a solution, move on to the next one. And it really misses the
right.
mark with, in my opinion, in all women's health issues because
Oh,
it's not a quick
100%.
answer. Yeah.
Yeah, 100%. I was talking to a gal a couple of weeks ago, and she actually is an attorney, and she became an attorney because she wanted to fight, for the medical field about women's health, right? So, like, she wanted to find these things and fix the problem, only to realize after becoming a lawyer and going to like, oh, I'm gonna go start on this problem first. If there's no problem, the system is literally doing what it's meant to do. The
Mhm.
the medical system is literally doing what it's meant to do. So there's just nothing to like really fight on that stance. So that's disheartening, but at the same time, welcome to the US of A.
Hmm. At least as of now, yeah. It's a
Yeah,
bigger journey to change that. But again, at least, giving women the tools to advocate for themselves, understand the medical system, understand that they might have to be setting themselves up for several visits, looking for different doctors, as ridiculous as that is, at least, empowering women to work with the system that is
absolutely.
currently available. Yeah.
Absolutely. That's one of the largest things that I will say is that be your own advocate, right? Being your own advocate, that means asking the questions, getting the answers that you are looking for, right? I often use the scenario as in like if I go to a restaurant and I get horrible service, I'm sorry, but you're not going to get $100 tip. You're gonna get a tip as in like, hi, you should do better.
Hmm.
That's my tip to you. But you're not gonna get, a crazy amount tip. Same way with your medical professionals that are in your roster. Like if you are going to a medical professional and they're telling you something like it's in your head, you have all the rights to be like, I think I'm gonna get a second opinion. I
Hmm.
think I'm not gonna listen to this because I know what's true in my body. Like this is my body. I feel it.
Hmm.
So most definitely.
Yeah, that's such great advice. And I think a lot of people don't realize that, or they're like, "Oh, this is the answer that I got from medicine, like from one doctor." But it can be so.
Right.
It absolutely could be something where, you know, it's that person is not the
Absolutely.
right fit
So
for you. They're not the one who
no,
can help, and finding the doctor who can. Yeah.
absolutely. So I say this as well. Again, shout out to Doreen, my mom. She has literally stated to me, I just remember back in the day, she used to state to me, there's a reason why they call it practicing medicine, because they're doing just that. They are practicing. They do not have all the answers. There's no way that
Mhm.
they could have all the answers to all the things. So yeah, find the ones that are willing to, if not not even like work with you, but willing to learn. Like, because
Hmm.
sometimes it's a partnership, right? We're learning from each other. Like, you're
Yeah.
telling me a symptom about PCOS that I may not know about. So, therefore, now I'm going to go back and I'm going to look in my medical notes. I'm going to look up some studies to see what's happening. Oh, this is a symptom of PCOS, right?
Mhm.
It's a learning process for both patient and provider.
Absolutely. And I love that you highlighted too, like that intuition that we have in our own body. No one is ever going to know your body better than you do. And so really
Absolutely.
feeling confident in that and saying, no, wait, this isn't in my head. I know what's going, like I know something is off. And pairing that with someone who can give you then the medical care and their experience and yeah, matching that together is really where some magic can happen.
Yeah.
Well, maybe to take it back to the symptoms, like maybe we
Yeah.
should highlight that a little bit more to say, like, for someone who maybe isn't sure if they have it or they do have it and maybe they're still experiencing some symptoms, what are the things that women should be looking out for?
Absolutely. Absolutely. So it's funny because I feel like this list grows every year.
Hmm.
I feel like there's something that gets added all the time. So the number one, most women are diagnosed with PCOS when the fertility thing. So if
Hmm.
they're trying to have a baby and they're struggling, a lot of times you'll go to the doctor and they'll be like, "Oh, okay, well, PCOS is the number one cause of infertility in women." So that's number one symptom. Also, weight gain. I like to pair that with a couple of other things. Weight gain. So your body kind of PCOS kind of tricks your body into believing that you're diabetic, right? This is kind of like why they give you metformin when you have PCOS. So metformin is a drug specifically for diabetes. So they'll give you metformin. So with that insulin resistance comes the weight gain, comes the here's one that you may not know that I learned. Tooth decay.
Mm.
So a lot of women with PCOS, they struggle with tooth decay, which is also a kind of a diabetic symptom, right? Um, you adult acne is something that's I just me personally, I think that's crazy because like, didn't I go through this already? Didn't I?
Hmm.
I'm well past that stage. So adult acne, hair loss on the head, but hair growth on the face, neck, back, just areas. And that's attributed, at least I believe it's attributed to the higher testosterone levels in women with PCOS. So you're thinking about, male pattern baldness, which is a testosterone thing. Let's see here. I said weight gain, acne, depression, and anxiety, which is a vicious cycle.
Hmm.
Because, and I also attribute this to the hair loss thing as well. Because
Hmm.
you're sitting here, I was just talking to a friend, like she was telling me her hair was falling out and she was stressing about her hair. She was anxious about her hair. Okay, so that means more hair is gonna fall out, right? You're
Hmm.
just going in
Hmm.
a vicious circle. So yes, and depression and anxiety. I also believe that comes with body, kind of body dysmorphism, right? If you're overweight, you're feeling like you're depressed, you're anxious about things, emotional eating, that kind of thing.
Hmm.
Um, what are some other ones? Missing or lack of, and I've heard the opposite as well, menstrual cycles. So I've also heard of women who their menstrual cycles are insane and last for months.
Hmm.
So those are symptoms of PCOS as well. What am I forgetting here? I know I'm forgetting a whole bunch.
Yeah, so maybe some of the pelvic pain. I don't think we mentioned that.
Pelvic pain.
Part of it.
Yeah, so like for me, the pelvic pain happened and it was due to my cyst rupturing.
Hmm.
I have heard women have pelvic pain for just other various reasons, like their
Hmm.
cysts don't rupture. As you stated, like the diagnosis of PCOS, right? One of the criteria is cysts on the ovaries. My cysts can be there any given time and be gone the next day. So I, like you said, the whole criteria for PCOS doesn't match everybody. That's a tough one.
Hmm.
Um, what else am I thinking here? I feel like I'm forgetting a major one, but I'm blocking here.
Yeah, I feel like you touched on a lot of some of the things kind of go along with the insulin resistance, like darkening of the skin or like kind of like a velvety
Yes,
look on the skin, which the classic,
right.
diabetic versus PCOS,
Hmm.
but not necessarily everyone gets it, like you said.
Yeah, and that's the same with the weight gain. We also have a lot of women that are, we call them thin, right? Thin sisters because they don't have the weight gain at
Hmm.
all. So again, PCOS looks differently in everybody.
Hmm.
My PCOS is different from the next person's PCOS, and it's just finding the things that, since there's no approved medication to treat PCOS as a whole. It's
Hmm.
finding those different outlets and avenues and treatments for each symptom individually. Like again, metformin, they put you on that. When you have PCOS, I have birth control pills, of course, which I know you and I could probably get into a whole another world of talk about that.
Yep.
But birth control pills, metformin, spironolactone, progesterone, all these things, they can treat different aspects of PCOS, but there is no one medication for PCOS as a whole.
Yeah. And I think, I mean, that is the reason in my mind of why it's so complicated to make a diagnosis. And also on the flip side, a lot of women are diagnosed with PCOS because they have cysts on their ovaries, for example. Like that's what that one
Yes.
piece, and they're at least suggested that they have that, and then it makes everything so much more complicated too. I actually was diagnosed with PCOS back when I was trying to conceive, and I didn't have it, which is good in the long run, but it was so confusing because then I went down this rabbit hole of like, oh, I have PCOS. It's because I was missing a period and my body was like trying to ovulate but wasn't. And so I had
Yeah,
these multiple cysts. Once I ovulated, they were all gone. And
right.
so the diagnosis is unfortunately too loose where it's missing a lot of
Yes.
women and then including a lot of women inappropriately. So
I
yeah.
absolutely. I said that in to somebody else just recently as well. Like that's the ultimate goal for PCOS Awareness Association is to get the right diagnosis for the right people
Hmm.
and
Hmm.
then get the right treatments for those people, right? Like
Hmm.
because yeah, the have being having over diagnosis for people that don't have PCOS, that's not helpful. That's not
Hmm.
helpful for you. That's not helpful for those with PCOS. That's just not helpful.
Hmm. Yeah.
So
Yeah, it
most
complicates things just
definitely.
way more than needed. Yeah, absolutely. Yeah. Well, with that, what is the with advocating for ourselves with PCOS, for those who maybe think they have PCOS, what's sort of like the next step? What's the like kind of trajectory they're taking or the, outcomes that they're looking for?
Yeah, absolutely. I would say one of the top things that I try and promote is having that team,
Hmm.
right? Again, if you are going to an OBGYN and they're telling you this about your PCOS, okay, what's stopping you from also having an endocrinologist and a dietitian, a nutritionist, a dermatologist? There's nothing stopping you from having that team. You would love that team to be within the same network so that they can talk to each other and see your records from each other, from each profession. But if you have to go outside, I mean, by all means, build that team.
Hmm.
And then just again advocating for yourself and not being so hard on yourself as well. I think that oftentimes, um, I strongly believe like social media and just, media in general has this vision of what a woman is supposed to be and supposed to look like. And when you do not fit that mold, you become difficult on yourself. You make
Hmm.
things so much difficult on yourself. I also feel like there's a lot of diet narrative out there that is not helpful. I feel like with PCOS, you need to give yourself some grace
Hmm.
to understand and learning yourself and what your body needs to kind of help those symptoms, right? Like, one of the things that I realized, a few years ago is that, I work a day job, so I sit at this desk all the time, and so I just threw a Fitbit on my wrist one day, and I realized I was getting one well under 2,000 steps per day.
Hmm.
With that realization, it was like, nope, I gotta get up. I gotta get moving. I gotta get active. Not necessarily active like what I used to be back, as a young adult, but at least get out, have some fresh air,
Hmm.
take a step up, step back, get at least 2,000 steps a day, at least, at minimum. Push yourself to 5,000. Next, push yourself to 10,000, right? Keep pushing
Hmm.
yourself. If you mess up and you have a bad day, there's those times where you're like, oh, I'm going to have an Oreo. And next thing you know, that Oreo turns into a whole sleeve, right?
Hmm.
Don't don't beat yourself up. Give yourself some grace and just restart the next day, right? Like, don't say to myself, "Well, I messed up now, so now guess what?
Hmm. Hmm.
The
Oh,
rest of this
gosh.
week, that's what I'm gonna do. Pints of
Hmm.
ice cream, all the things.
Hmm.
Just restart the next day. Give yourself some grace. Feel better. Put yourself in a better mood. Do something that you love to do. Listen to some music, watch some TV, something. That's really. Uh, I feel like, especially for me, I get high anxiety, so I need to just chill for a second. Put myself in a corner and chill for a second.
And that's such a good, great advice for every woman because, yeah, we can be so hard on ourselves. And even when we're, trying to take good care of ourselves, even that can become so hard to have all of
Right.
these expectations on ourselves. So that's great advice. Just like take the little steps, get yourself moving, get yourself the basics that you need to feel good, and
Yeah.
yeah, just let it go when it maybe wasn't the best day. Yeah.
Right. We all have those days.
Hmm. Yeah. And it sounds like, especially with PCOS, it sounds like, your journey again to highlight this, that what an emotional toll PCOS can take on you. So I think even more so to be so kind with yourself and so, loving to yourself like you would to a friend or family member rather than
Right.
beating yourself up and expecting that to get your motivation going. I feel like
Right.
it's important.
Right. Absolutely. Yeah. And trust me, there are days that I feel like beating myself up, but you just gotta take a step back.
Hmm. Well, with that, I mean, again, you've given so many great tips. Any other tips that you'd want to give to a woman who thinks she has PCOS or has PCOS?
Um, Oddly enough, I am such an open book, right, when it comes to PCOS. I oftentimes give out my direct line, my direct email. So I feel like um, we have resources within PCOS Awareness Association, and I can be a resource for people as well. So please feel free to contact me directly. I love hearing stories. I love, connecting with people. So if anybody needs help, any further help, please let me know. It's what I'm here for.
That's so kind of you. And I really am grateful for you to, again, turn your story into this movement for women to be able to be better educated. And I should say even women, all people, to be
Yeah,
better educated about PCOS, what it is, what it can look like, and creating that conversation that can then, have that ripple effect to educate everyone,
absolutely.
even though our medical system and our education systems might not be, where they could be or should be right now, being able to spread that awareness, I think is really so
Right.
incredible.
Right, absolutely. Yep, we have couple programs that are for outside of, women with PCOS. So we have the Man of Teal program.
Awesome.
My father actually headlined that program. It's specifically for fathers, uncles, brothers, anybody, any male that's out there that wants to be an advocate for somebody that they know, or just in general, women with PCOS. We love it. We love it. And then
That's
we also have the program Partners of PCOS, and those are for those significant others, right? Boyfriends, girlfriends, husbands, wives, whomever is in your life that needs that extra little Um, it's not a push. Sometimes it's just knowing that they are there, is what's needed, right? That extra little tips, like here's how to handle this situation. Here's don't tell them to lose weight, Don't do
Never.
that.
Don't ever say
Please
that.
don't. Right? Here's some other ways on how to phrase said things. So
Mhm.
most definitely we've got we love all the advocacy.
That's amazing. Well, where can people find you and get more information from you?
Yeah, so our website is www.pcosaa.org. We are on all social media platforms, Instagram being our most viewed would be PCOS AA would be the tag on there. Um, X PCOS AA, and then Facebook PCOS Awareness Association. We are in the process of revamping our website, our YouTube, our we've had we've had Pinterest since like day one, and I
Hmm.
didn't even realize that we did. So revamping Pinterest as well. So if you need any, tips and tricks on Pinterest, please feel free. We're just we want to be wherever you are.
Yeah. Amazing. Well, already your website has so many great resources. And yeah, again, I really appreciate the work that you're doing. I think it's amazing. And I'm glad that we can share this with our listeners here to be able to
Yeah,
also have this, awareness for themselves and be able to spread this to those people in their lives. So thank you so much.
absolutely. Thank you.